Oh, you know what it is. All right, we're just working on the new sound system because we're getting an echo here. Are you hearing an echo also?
Yes, yes.
All right. Give us a second.
Are you muted? I'm muted.
Yeah, I got it.
How's this? Echo still? Yeah.
Hello? Hello? No, I put this on and you can't hear me. Hello?
You want to get me back on?
Yeah.
I messed up. I shouldn't hit the thing. If I don't know what I'm doing, I shouldn't be clicking all these other buttons. I should know that by now. That doesn't help. There. Huh. Launch me. Nope, it's launching. You host when? Thank you. I won't fool around again. I'll pay attention. Oh. All right.
Unmute. Unmute. Is it really echoey when I'm talking?
Yes.
Yes. We,
Can I hear you?
we have a new speaker system they installed. And obviously we're getting all right. This better?
Yes, a little bit.
Well, when in doubt, unplug the system.
It's okay. Yeah, it's
Okay.
okay.
So we don't have the large speaker here.
Yeah, it's much better, Bruce.
Okay. I guess. Okay, we're all set to start, Mr. Chairman.
Okay. Do you hear me okay?
Very good.
Okay, great. All right. Welcome to the September 20th, 2021 meeting of the Yarmouth Board of Health. Just as a note, this is a remote participation, meeting. Specific information such as instructions and guidelines for remote by members of the public and or parties with a right and or requirement to attend this meeting can be found on the town website at www.yarmouth.ma.us. For the public portion of this meeting, members of the public who wish to watch or listen and participate in the meeting may do so by going to the town website. It's probably, and there are instructions there. You can also go to zoom.us. And if you click on join a meeting, you need to put in an ID number. And the ID number for tonight is 847-5839-4044. So with all that done, we can start on the agenda. Actually looks pretty light for tonight. The first item is public comment. If anyone has called in, now would be the time to speak up.
Yes, we have a Mr. Nicanello in the public that would like to speak, Mr. Chairman.
Oh, good. Why don't you go ahead, Nick?
Yes, good afternoon, everyone. Thank you very much. Tom Nicanello from the very beautiful village of Bass River here in the very historic town of Yarmouth. I'm just calling in tonight to thank the board and the health director. As you know, Saturday we had a great response. Mother Nature opened the clouds and the sun came out, and we had a beautiful parade going down Route 28. Thanks to your guidance and all the education you give to the people out there. They were being safe, they were being distant, and they were actually having fun and getting some mental health replenishment. So with that, I wish you all a good meeting, and thank you all very much for the work you do.
Great. Okay, thank you. Appreciate that. Anyone else?
We don't see anybody else that wishes to come in, nor did we receive any separate emails. You might want to go over to attendance, Mr. Chairman. We do have
Oh, sure.
Charlie with me.
Okay, so that's one. Mary, I see your picture. Are you there?
Present.
Okay, Eric, you with us?
Here.
Okay, very much so. Deborah, I know, is not going to be able to make the meeting. I'm Hillard Bosky. I am certainly here, so we can move forward then. And most of this meeting is really an update on the coronavirus, on the pandemic, which we have listed here: statistics, vaccination rate, positivity rate, mask advisory for starters.
Go down to where it says myself.
Okay, Director Murphy, this is you.
Okay. Board members, public, I'll provide an update on the status of our COVID within the town. Okay. Our positivity rate that comes out every Friday This is our numbers. Just go down just a little bit so we can see. There we go. So last Friday, our positivity rate was down to 2.93, so it had gone down. It was going down the last 4 weeks, but shot up a little on September 8th. And it might go back up a little this week also. We've seen a couple extra cases come in. Are you still hearing an echo?
Slight.
Slight, okay. Okay, so we do track our number of cases. You can see we're pretty much steady on the left-hand side here, cases 57, 58, 49. So we've been steady with that. So obviously our cases have come way down, percentivity since the beginning of August. Okay. How does that leave us compared to other towns on the Cape over this last week? You can see we're at 293, so we're down the lower end of positivity rates on Cape towns. You can see Provincetown is the lowest at 1.26, and Provincetown used to have the highest for several months when they were up over 10. So their numbers are down. The county's at 4.7, which is very high. And you've got Sandwich and Mashpee and Chatham is still very high. Go down just a little bit, we'll see where the state is. And the state's at 2.35, and this is over the last 14 days. It comes out every Friday. So I guess we're staying steady. I mean, we need to improve, but at least we're on the right track.
Yeah, it looks like the shift was from lower to upper now.
Yes. All right, so the next one just shows over the last 14 days how some of the other towns have been, and we can see at the bottom at the first week in August 11th, the first column, Provincetown was up at 765. You're right, Mr. Chairman, that now that's kind of flipped the other way. We've always been in the middle, but we've decreased, so we'll monitor that. We've also taken a look at that. We've seen the increase in the county positivity rate over the last month. And even the state's gone up a little bit, but stayed kind of in that lower range. Okay. Kind of just trying to figure where we are in the waves here. Does this show the whole screen? We can see the first wave we had back March 11th. It's kind of a crude drawing that we're trying to get this in, the second wave. Then we've got the fourth Delta. And is that all the way on the screen, or do we have?
It looks fine.
You can see the fourth wave of the Delta is really increasing the numbers. You know, they're in that 40 category that, you know, we had earlier when the pandemic just came out. So we can really see that fourth wave Delta plugging right along. And it's kind of staying with us. It's just not a separate spike. So it's more of a true fourth wave. Thank you. And then we go into where our vaccination rates are. And I think that's important when we break it down by age group on the far left column. Then we have what that population is within town. And then we go to the light blue, individuals with at least one dose. So out of that 12 to 15-year-old, we see we have 512 children that have at least one dose, but we've only picked up 3 from last week. And that's the number that I put on there, is how many were picked up from last week.
That's concerning. I mean, school just started, especially.
Yeah.
What do people think about this? That's all. It just doesn't seem to, 3 more kids doesn't seem like a whole lot to me.
Yeah, Yeah, and I mean, even the 16 to 19, we're at +4.
Right.
With individuals, 1 dose. But if you go all the way over, fully vaccinated is 428. So we did pick up 21 in that age group that probably got their second dose during this time period. But the numbers are still low. I mean, in those age groups, we do much better when we look at our elder population, where we say 75 years and older, we're at, 95% with at least 1 dose. So we're doing good in the age groups. Even 30 to 49 has increased, which has been a tough group. So that's something that we also touch base with. I am talking to regularly the school lead nurse, Kristen Dwyer. We talked to her today, how the school's going. And I have a call into the assistant superintendents that we've been crossing paths just to keep the line of communications open with them. So we still have some signs out around town to, get vaccinated. We have the message board on Route 28. We have the advisory noted at Town Hall, and we've notified the Chamber of Commerce of it. So I think it's just, we're at the people that know that want to get vaccinated, seem to be vaccinated. It's just.
Bruce, I don't know if you know the answer to that. What's the requirement of the physical exam for students? I mean, decades ago, there was a mad rush before school started where all the kids have a physical exam by their pediatrician.
For
What
sports.
happens now?
Right, that's for sports, but a COVID vaccination is not mandated, such as the other vaccinations the school children need to get.
I was just thinking that if they're seeing a clinician, it would be an opportunity to get vaccinated if they were so inclined. That was all. It was just.
Yes, if they're so inclined. So that's my usual COVID update, maybe a little shorter, but that's where we sit. This is what we monitor every single week. I'll take general questions from the board.
Bruce, I have a question. And I know that in general, that the whole country, we don't have the data that we would like to have, but Phil's report today said that 47% of the cases of COVID that we have been amongst the vaccinated. And I'm wondering if we know if those vaccinated are part of the older cohort, assuming that they've been vaccinated the longest and maybe having the waning immunity. Any sense of that?
We talked about briefly at the end of the day when he put that statistic on, and I said we really need to break it down probably tomorrow on 47% out of what number, what age number. So we're going to look at breaking that down, and
Great.
we'll probably do it on Fridays when we usually say what our positivity rate is, and we'll probably put that into our future statistics.
Okay, good. Thank you.
But you are correct. We're seeing about 50% of the positive cases are coming through vaccinated people. A lot milder symptoms.
Mhm.
But, depending on their underlying conditions, we do have one person, positive person that's vaccinated in the hospital now.
The hospital's still doing okay?
Yes, I think I got one more sheet. Oh, look at
Oh,
this.
yes,
Thank
you do.
you. Look at that. Thank you. So that's what we've been following from the beginning. And we can see that the highest usage was in the hospital was back March 29th when Cape Cod Hospital had 30 beds and two beds in ICU. Then it's kind of really leveled right back out in April and May. And if we go right down now, it's as of last week, we can see 8 beds. They still have a COVID floor at Cape Cod Hospital. So as of last week, I think when this came out Wednesday, that's the numbers of 8 no in ICU, and a total of 12. So it's been low and flattened off the last several weeks, but we're starting to hear more, possibly people going to the hospital as needed.
Okay, Bruce, anything else in the update?
No, I think that moves us forward with COVID, and then we just move into our still on recovery month, National Recovery Month. This is a flyer that we're going to need to get out on social media. But September is all part of Recovery Month. So working with the Town Substance Awareness Committee, YSAC, we had that event down at Smugglers Beach that was very well attended, that we had the person at our last meeting put on. I did stop down and watch that. There was about at least 200 people, and that was a terrific a night out for discussing recovery and people coming forward with pictures of their lost loved ones. And it was very very well attended and very moving. So as part of further education, the committee is going to have 4 presentations that people are going to be able to get on board and to listen to. We were thinking of having a speaker session, but we've turned it into, it's going to be recorded so people can log on and do a webinar training themselves when they have the time. And we do have the how to register at the bottom, and then we do have what the 4 topics that people might want to log on to at any particular time.
That's great.
I guess I can say the first one is going to start, it's going to be 4 days in a row, so people don't have to get on and listen to them all 4 days. They can get on and, register and use them as they want. But starting on, next Monday, the 27th, the topic is substance use disorders in special populations. And then the 28th, intersection substance disorder and intimate partner violence. That's Annie Catalano from the police department. We'll be speaking on that. Then we go to overdose education and harm reduction. We have a person from Kate Leaner from the Barnstable County Human Services. And then we end up with, on the 4th day, on the Thursday, the 30th, treatment programs that are available in peer support. And this is also from the recovery coach that the Board of Health supports down at Duffy Health Center on recovering and following people in the community and helping them with treatment programs. So we think it's a very good series, and we're going to try to publicize it as much as we can we're looking at starting the own town webpage on this, and then also getting it out on social media.
Okay. Anybody, any comments, anything? If not, we can move down.
Okay? That
So,
brings us to the minutes.
Yeah, approval of the minutes, number 4 there in the agenda. This was from our August 16th meeting. Hopefully everyone had a chance to review it. Anyone have any edits, comments? See that there are none that I can see. They look fine to me. So I guess it's really going to come down to Charlie, Eric, myself. Mary, I don't think you were at the meeting.
I was not.
Okay, so someone want to make a motion here to approve the minutes?
I move that we approve the August 16th minutes.
You, is there a second to that motion?
Yeah, Charlie seconds it.
Okay, thank you, Charlie. Okay, any discussion about it? If not, and if you want to approve the minutes, just raise your hand and say aye. And it's aye. Charlie, your hands up?
Yep.
Good,
Yep.
okay, so minutes passed and we're on to the new and old business. Anyone, anything?
I would just make a suggestion, Mr. Chairman, we still, we may have a meeting scheduled for the 1st of October. We're waiting to hear from an applicant now, but I believe now that after we've talked, I've looked at the tentative agenda, and I do believe, Mr. Chairman, that we will have a meeting in October, and I'll have to get back to you. It may be the 4th.
Okay,
We have a septic repair tight tank coming to the board because the wetlands are too close. They can't get a system in at all.
right,
So they wish to move forward on that. So that looks like that will be on the 4th. And obviously there'll be another COVID at that time also.
okay,
Update.
sounds good. Anyone else?
Yes, I would like to just speak for a few minutes on the RAC, the Water Resources Advisory Committee that I'm on now.
Great,
We have a meeting next week. We haven't had a meeting for about a month or so. But next week, we're going to be talking about the messaging before the fall town meeting. Because if you've been keeping up at all with what's going on with wastewater treatment, Yarmouth has decided to go it alone because the town's been waiting on, well, it was waiting on Dennis and Harwich kind of backed out because of things that were going on in the town. And I guess their cooperation agreement with Chatham is more substantive. Dennis asked for some time last winter and Yarmouth, agreed to that. But then when it came time for the rubber to hit the road, Dennis was still kind of, backpedaling and not wanting to go forward. So RAC recommended, and the Board of Selectmen also decided to go forward with a Yarmouth-only treatment plant plan. So that's basically what's going to be on the town meeting warrant, funding that update. Apparently, initially, Yarmouth did have some plans to have its own treatment plant before they went into the Dennis Yarmouth Harwich partnership. But those plans need to be updated, and there needs to be money agreed upon to be spent for that. So right now they're looking at a year from now, trying to put the proposal forward to the state. And part of the whole picture is that this winter Route 28 is going to be worked on by the state. And unless we have our plans in hand and are going forward, then we miss the opportunity to take advantage of the road already being torn up. And the state does not allow you to reopen it for 5 years afterwards. So that would really put Yarmouth back in terms of progress toward wastewater treatment.
yeah, that's awful for the 28 to be dug up twice for the businesses there, that's awful.
Well, and it couldn't be for another 5 years. The
Yeah.
state doesn't allow it. So yeah, it would be it'd be crazy.
Mary, thank you. Appreciate that. Anyone else? If not, we would be at the 6th item on the agenda. If you all look at your agenda, it says adjournment.
I move that we adjourn.
Is there a second? Thank you,
Second.
Eric. Anyone, any comments, anything? If not, we can vote. All in favor, just raise your hand, say aye.
Aye.
That sounds unanimous. Thank you, everyone. Stay safe.
Thank
Be
you.
well.
Thank you.